Beg it. Put him inside. Oh, let me see. Make him pee.
We call it Auntie Cadine all the time.
Oh, that's so nice.
Come, River. Come say hi.
Oh, hello. How are you? Nice to meet you. What's up, baby? How you doing? You're good? Nice to meet you. Yeah, so we're going to talk afterwards. You good? Happy New Year.
Happy New Year.
Thank you. And I wish you all the best for 2022.
You too.
I've heard a lot of good things about you. So we're going to talk afterwards. You want to stay in here? You want to stay in the corner?
Okay.
Oh, sure. Yeah, man. You can stay in the corner. Yes.
All right, sir. Over there, sir.
Yes.
Yeah.
My good fans, them. Hi, River. Yes.
And you say water, right?
Yes,
Yeah, man.
please.
Yes, man, sir. Make sure
Yeah.
the phone on silent.
Yeah. Boy, uno skin get uno love people, you know, uno. But me no wrong uno still. Me no wrong uno still. Oh, Anthony Brown from Lime Hall. Oh, hi Anthony. All right.
You cool?
Yes. Oh, so Tasha, is this set properly? I don't even know. What up, baby?
You good?
Are you good?
Yeah,
Yes,
man,
respect.
We're good.
Tajna, come check on this thing if it's set good for me now, please. Damien, the me voice good? Oh, you're good? Your phone good?
Yeah, man.
Okay, good. Alright, so that's your headset. You say his name is River?
River.
Okay, River. Like as in the river?
As in River Nile. River Nile is his name.
Oh, wow. Look at Auntie got it, getting it right. Yeah. Turn up for me, please. Heart of a champion, heart of a champion, yeah, heart of a champion. Good afternoon to everybody locked and loaded. It's Miss Kitty Live, your one-stop entertaining afternoon show. Hi, Elaine Lawton. Listen, every time I hear this song, you guys know I just get so emotional and I really love it. Good afternoon to all the champions out there. I know we're living in challenging times. I know we're living in stressful times. I know we're living in financially austere times. It's an overwhelming time, but I just want to send a word of encouragement, positivity, just love to each and every person listening to my voice right now, encouraging you to keep holding on, to keep praying, to keep pressing along. Do not give up hope. Once you have air in your lungs, you have an opportunity to make a change and to make your life better. I know there are many days, many nights, our backs are against the wall. We want to give up with us one throw in the towel. We can't bother wear one more mask, one more time. I will tired of everything we are going and the different variants, Isha, the old lady, Omicron, Optimus Prime, the all of them Star Wars. I would have tired of it. But be patient. Be patient. Be courageous. Be brave. Let us try to be warriors and not warriors. This too shall come to pass. Make we just go on all strain. Go on push along. Keep growing. Keep going. Keep growing, keep praying, keep believing, keep hoping, all right? The audacity of hope. Remember what Dr. Leah Kim Samaj spoke to us about yesterday? That, we have to really make sure that our brain, which is the hardware, our mind, which is the software, give us the printout that we want, which is our life, all right? So guys, just sending you lots of love this afternoon. And thanks to each and every one of you for supporting my show and for making it Miss Kitty Live right here on Nationwide 90 FM. Good afternoon to a young king, or should I say young prince, in my studio this afternoon. River Nile. River! At them to the world. Big up your nice, clean, good mother. Your clean, good, educated mother. Lady Terry, first lady, could never be the worst lady. You understand? Yeah? Wife type. And you the man choose. Not refuse. Yeah, without apology. And that's what the thing said to big up all the good man. Them. You know me like the good man. Every time I see the good man, they give me hope in life. Broke man, I'm not taking it back. So, good afternoon to River in studio right now. But it is great pleasure. This gentleman, I remember when I thought I had COVID. Well, when I started having some symptoms, no smell and no taste. And I called him and I said, Daryl, not feeling well. I don't know what's going on, but I think the symptoms I'm exhibiting are classic of COVID-19. He, along with his wonderful, professional, kind staff, said, come, quickly. Did one test, it came back negative, but I still never like how I feel. Did another test, came back negative, I still never like how I feel. He said, come again. And we did another one, and it came back positive. But let me tell you, all the horror stories that I had heard before, and all them are going to push something up in your brain, and all it's going to go in your middle of oblongata, and all them are going to shoot it in your pancreas. I was so afraid. I was so scared. And when I went there, and the nurse, she was so capable and so professional. And when she was done, I was like, ma'am, are you finished? Because this is not what I see on TV or what I've heard about. And she said, yes, Miss Kitty, it's all done. And just the care and professionalism at rapid testing right there in Medical Associates, Gynae Associates, I was so pleased, and I want to say thank you. And he's here today in my studio, and it is with great pleasure that I welcome you to my Systems of Success series for 2022. Dr. Daryl Daley, good afternoon and welcome. How are you?
I'm great. Always a pleasure being here. Thank you so much.
Happy New Year, Doc.
Happy New Year.
First, may I see you?
Yeah.
From them time.
From them time.
I wish for you and your wonderful staff a prosperous and magnificent 2022.
Thank you
and
so
may you
much.
continue to grow, thrive, and strive in as many ways as possible. How have you been?
I've been good. I mean, the testing has been pretty crazy and intense, you know. Additionally, work has been pretty intense, but, you know, we're still pressing forward, still moving, still doing what we have to do.
Absolutely.
You know? No other choice.
Absolutely. Well, firstly, you're our doctor this afternoon, or consultant this afternoon, obstetrics and gynecology. We've often heard those terms, you know, doctor, you know, obstetrics, obstetrician, gynecologist. Who is an obstetrician? Who is a gynecologist? What do you really do?
Okay, lovely. So, obstetrics and gynecology. So obstetrics, it deals with the study of pregnant women, or the aspect of medicine that deals with pregnant women.
Yes.
And gynecology deals with the study of medicine that deals with non-pregnant women. So essentially, we're looking after women throughout all the varying stages of their reproductive careers.
Okay.
So when we're training, they teach us both obstetrics and gynecology.
Yeah.
So when you're finished and specialized, you can choose what you want to do. You know, because I have a lot of colleagues who don't like the obstetrics because it's very taxing.
Yes.
You know, it can be very demanding. The babies can come at any time. It's very draining. And some people only just focus on gynecology, which is just, you know, sit in the office. You rarely have gynecological emergencies, and you can have more control of your time. So
yes,
basically, OBGYN is the study of women, period.
Okay.
Period.
And so that's where you will specialize.
Yes.
So you're like the top boss in that.
I'm an OBGYN.
Very well.
Well
Well
trained.
trained OBGYN. How long have you been in this particular field?
Well, I started officially training in 2008.
Yes.
You know, and I officially graduated in 2015.
Very well.
Right. So I've been in this field for more than 10 years.
Yes.
And, you know, you may not know, my father is a gynecologist
Yes.
as well. Yeah.
Yes.
And
Hi, Dr. Daley.
I kind of grew up mimicking and watching what he did.
Yes.
You know, so I followed in his footsteps directly and indirectly. And
See there?
It
Blood follow
It
vein.
turned out all right, you know.
Blood
It turned
follow
out all
vein.
right.
You see why you have to have good man at them, something about that, but you understand? So if doctor can't have doctor, if I go have, yeah. God, man, yeah, you see, yeah, blood follow vein. Well, I'm very happy, and I know your father must be very proud of you and all that you've done. So, Dr. Daley, let's jump right in it, because at this time, there are many women, you know, the world has been inundated with information about COVID-19, and a lot of our women's health issues have kind of been sidelined, and that's not really been the focus. And I wanted to focus on some things and some areas of concern and importance that you would encourage women to ensure that we're always on top of our game. Because a lot of times, if our reproductive health is not at its best, it can be very debilitating. It will cause us to not be able to go to work, not be able to function well at home, and just cause discomfort, right? So let's start off with the one that a lot of people have been talking about, and we've heard, pap smears. What is a pap smear, and why is it important?
Okay. So a pap smear is essentially a test of the cervix. The cervix is the neck of the womb. Yes. The part of the womb that opens up to let a baby out for all intents and purposes, right? So we as specialists separate the womb as the cervix and the uterus, two separate organs, but the layperson may just call it one, right? So for all intents and purposes, the cervix is the neck of the womb. And what a pap smear is essentially, it's looking at the cells of the cervix, and we're looking for the presence or absence of precancerous cells. Because what we do know, the virus called HPV, human papilloma virus, is a causative factor for up to 95% of cancers of the cervix. So cancer of the cervix is one of the very few cancers that we actually understand. It's not like the others like brain cancer or kidney cancer or colon cancer. We're not too sure. Most of the times when you have cancer of the cervix, it's directly related to the presence of HPV, right? So what the pap smear is looking for after many years, the HPV will enter the cervix and cause changes to occur. So it goes from normal to pre-cancer to cancer. So the whole idea of doing the pap smear is to pick up these precancerous changes so we can intervene and prevent it from going to cancer. The famous statement, prevention is better than cure.
Yeah.
You know?
All right. So how often should women be doing their pap smears?
Okay, a good question. Initially, I mean, the old process was every year. Every year, they're drilled into us in medical school, but as time has progressed, they realize that every year was almost over-screening, right? Because the pap smear is a screening test. You're looking for the presence of disease in the absence of symptoms. So what the latest studies have shown is that pap smear should be done every 2 to 3 years from the age of 21. And then once you reach the age of 30, you can do it every 5 years with the additional testing of a HPV test as well. Right? So the screening has kind of laxed, but once you do what you're supposed to. So I recommend my patients every 2 to 3 years. And if you want, we can do the HPV testing with it as well. It's a little bit more accurate, and it can interpret the pap smear much better when you have the HPV.
So how is the HPV test done?
It's the same test. Actually, in the States and other countries, when you do a pap smear, it's actually looking for the presence or absence of precancerous cells, and also the presence and absence of HPV. In Jamaica, however, it's 2 different labs. Right? So one lab will examine the pap smear looking for the presence or absence of precancerous cells, and one lab is looking for the presence or absence of HPV. But the two of them is called co-testing. They'll give you a lot much more information. It's better to interpret. So especially when you have these borderline pap smears, the presence or absence of HPV can help you to interpret it much better. Much better.
What if, doc, say for example, cervical cancer or cancers run in your family, and you have a genetic disposal to it, should you still do it more often or still do the 2 to 3 years?
That's a very good question. And my answer to that is that HPV and cancer of the cervix, it's not related to any genetic or family predisposition. Essentially, it's related to your personal sexual history, because HPV is sexually transmitted. It's the most common sexually transmitted infection, right? The latest statistics show in the average person's lifetime, they've been exposed to HPV at least 1 in 2, So it's very, very common, but everybody's familiar with the immune system right now and COVID, and everybody knows that how the immune system works. So the immune system is very effective in clearing HPV. And a lot of the times, again, because of COVID, HPV is asymptomatic, right? So again, that is how the pap smear comes important. Because a lot of times you don't have any symptoms. HPV can cause genital warts. That people may be familiar with that, but majority of the time there are no signs or symptoms. And it's highly contagious, and it's spread from skin to skin. Condoms don't protect against it, and it loves the female genital structure and the male, right? So it will cause cancer of the penis.
Right now.
Cancer of the anus.
No.
Cancer of the vulva. Cancer of the throat. Throat cancer is associated with HPV. So all those oral sex, you can get HPV in the throat. A lot of information to swallow. But it's
literally. Literally. Oh my God. Say, but just feel like, I want to go over. They don't accept none this year. None reopening in Jamaica. Where is Mary and a little lamb? I feel like I want to lie down and cover up my body. 19 minutes past 4 o'clock. Dr. Daryl Daley here with us, giving us all the information that we need. And guys, this is why I am so happy and honored to have like a Dr. Daryl Daley on my show, because this is information, Calico, that we don't oftentimes hear. And the truth, Tajna, is we have to hear it, because when we know better, we can do better. Because some people are oblivious to facts like these. Me never know that something there so bad. I've heard of HPV, human papillomavirus. I know, but you see why you have to stay up to yourself. Keep yourself circumspect. Rest your brain. Rest your body. Rest all over. Okay? All right, doc. So the HPV can cause all of those
things.
All of those things. And you're saying that by doing a test, we can mitigate the problems that it may cause.
Definitely.
So it is important to do it.
Definitely.
So guys, we need to do a pap smear and we need to do our HPV
co-testing with it.
Co-testing. So when we go to our gynecologist, ask for it.
Definitely.
Very well. You see it? And that's what it's Calico. You said the same thing we're talking about, Keisha. There are times that if I didn't talk to Dr. Daley today, I wouldn't know to ask for an HPV. You test, you go for your pap smear, but I didn't know that, okay, testing for HPV would actually make it better to understand what is going on there. So ladies, we need to ask for our HPV test. By the way, doc, well, I know you're not a man doctor, so to speak, for the males, right? But should males be testing for HPV
Well,
too?
it's kind of hard to test for males because we know HPV loves the cervix.
Okay.
So there's no blood test for the HPV, so you have to do a swab.
Oh.
And the only real thing you can really swab is either just 3 orifices male have.
Yeah, gotcha.
Yeah, so it's and it's not really beneficial because usually the HPV, unfortunately, it's a female disease.
Yeah.
It happens in male, but it's more common in females because we know that HPV is a causative factor for the cervix, and the cervix is the main organ that can linger for a while and you not know.
Yes.
If something is there brewing.
Yes.
So HPV testing on men is not really that effective
Yes.
as it is in women.
So the onus is on women to
The
go and
onus
get it.
definitely is on women to get the test
Very
done.
well. So ladies, when you go to your gynecologist for this year, please ask them for your HPV test, okay? Okay, doc, fibroids. Very common in women of the Negroid race.
Yes.
Why is that?
It's one of these things we're not sure about. Fibroids, they are non-cancerous growths of the muscle of the womb, right? How I like to explain to patients, I compare the uterus like an avocado pear. It has 3 layers. The skin, the green part, the yellow part is the muscle, and the cavity where you take out the seed. So fibroids can occur at any level in the uterus, right? And as you said, it's very common in black women, and how it normally presents is heavy, painful, prolonged periods. And what can also happen is that you're bleeding for so long over such a great amount of time that you become anemic. The blood count gets very low.
Yes.
So women who are anemic can be very lethargic and short of breath, weak, just feel lazy all the time, because the blood count is very, very, very low.
Yes.
So that's what we call symptomatic fibroids. The fibroids can get so big also, it can look like you're pregnant. I'm sure you've heard of women
Yes.
like that, and it can actually, because normally the uterus is in the pelvis, behind the bladder.
Yes.
But sometimes it can grow up and out,
Yes.
can press on the bladder, makes you want to pass urine all the time. Press on the back passage, give you difficulty passing stool. It can even press on the kidneys and the kidney tubes and cause the kidneys to back up with urine.
Yeah.
So it can be very detrimental in the long run.
Yes.
As to the cause, we're not too sure where it comes from. We just know it's very common in black women.
Yes.
And there's a familial link, usually mommy and daughter
Grandma,
related
yeah.
and grandmother. There could be a dietary connection. We're not too sure as well. Nothing in stone. I did a study. I didn't find any correlation between diet and recurrent fibroids, but some evidence is there, but nothing is concrete. So it's one of these things that we're not too sure where it comes from, versus like the HPV and the cervical cancer that we know that cancer of the cervix is caused by HPV.
Yes.
We're not too sure what causes fibroids, but there are definitely certain risk factors that are there and present.
Well, women who have fibroids or think they may have fibroids, because sometimes we grow up hearing about these things, but we think it's quote unquote normal. I just have to live with it. I just have to suffer through it. But are there any solutions? So women who may be experiencing the symptoms that you just told us, what options do they have to relieve themselves or to get rid of that kind of pain, the heavy period, etc.?
Well, definitely if you're symptomatic, if your periods are very heavy and painful, and definitely if you have any weakness, constipation, frequency urinating, you should definitely get assessed properly, because not all fibroids require surgical intervention. Some fibroids you can watch and wait
Yeah.
to see what happens. Some fibroids you can give some medication to slow down the bleeding, can give some iron tablets to bring up the iron count. Some fibroids will require surgery.
Yeah.
Some fibroids you can do interventional radiological procedures to shrink the fibroid. So every patient is individualized.
Yes.
So what goes for Kadeen may not go for Tajna,
Yes.
It's everybody is different,
Yeah.
So they need a full assessment. I always tell patients, doctors are detectives. We get piece of the story from talking to you. We get piece of the story from examining you. We get piece of the story of doing our investigations, and we can put everything together and we can solve the crime and know what's the best treatment for you.
Yeah.
So everybody is individualized.
I like that you said that, Doc, because oftentimes we'll hear Tajna go to the doctor and he get fair diagnosis, right? And then me hear it, and then I think it means that it's for me. And then me get afraid, and I say, oh, me now go. And not knowing that everybody is an individual, and it is not a one size fits all. You have to go to your doctor, talk to your doctor. If Tajna doctor prescribes something for her, even though it sounds like the same thing that I might be having, it does not necessarily mean it's for me. So you cannot borrow people medication. You cannot borrow people diagnosis. You have to go and get your own. And I say this because I know sometimes it can be very, intimidating to go to the doctor to hear, and your friend come tell you, and when Jamaica and tell you something, when them go down in night and tell you something them, remember me tell you, you're afraid and about I want gun away, you just keep quiet. You don't want to go anywhere. But delay can be danger, and sometimes people are suffering in silence unnecessarily, because maybe if you go to a doctor like Dr. Daley, and then as him say, you tell piece of the story, him do the examination and him doing detective work, the treatment or the course of treatment may be different and maybe not as bad or intensive as somebody else.
Definitely. And a lot of times it could be an incidental finding. You're pregnant.
Yes.
You go to the doctor does an ultrasound and you see a fibroid, and oh my God, doc, there's a fibroid there, but it's you didn't know it was there until you became pregnant.
Yes.
Or you go to the doctor does a pelvic exam or examine, and many times I've had patients that you examine your uterus feels a little bigger than it should.
Yeah.
And again it boils back to this terminology, symptomatic versus asymptomatic.
Yes.
We're all familiar with it now because of the COVID-19 pandemic. So a lot of women, I would say unofficially 70% of women in Jamaica have asymptomatic fibroids, meaning they're very small, they're not causing any problem. You're not going to know it's there until something happens.
Yes.
You understand?
Yes.
And then the other 30% are symptomatic. So it's fairly common. Fairly common. I tell people that's every gynecologist in Jamaica's bread and butter.
Yeah.
Definitely.
And it's nothing for women to be ashamed of.
No.
Nobody goes and picks up any sickness or ailment or anything like that and call it down on themselves. There is nothing for you to feel ashamed of. If you have it, just seek the help from the requisite persons, the professionals, and get their advice. I'm happy you talked about pregnancy, Doc, and it's a great way to segue into pregnancy during this pandemic and all that is happening. There are some women who are pregnant right now, a bit apprehensive as to, oh my God, I'm scared to go to the doctor because I don't want going to go catch nothing, will my baby get the COVID? What is going to happen? The vaccine and the baby, how is that going to happen? And there are some women too who want to get pregnant right now, but are also afraid. Talking about pregnancy and this pandemic.
So this pandemic and pregnancy is still very early, but all the evidence thus far has shown that the vaccine is safe in pregnancy. That's the first thing. And secondly, the virus doesn't directly affect the fetus versus other viruses in the past. We've been with this virus for about 2 years to make this diagnosis or this conclusion, right? So how I encourage patients, I recommend a vaccine for all pregnant patients regardless, and I still encourage them to get their prenatal counseling.
Yes.
Talk to their gynecologist or their obstetrician before they get pregnant, and so they can get the proper guidance where it's concerned. And how I encourage them and say, look, the Delta strain for sure, what we found was that pregnant women were really getting sick.
Yes.
That we found that in all the hospitals. I work at Maypen. All my colleagues were saying the same thing. The Delta strain versus like the strain earlier, we're finding that a lot of pregnant women are getting really, really sick. This strain thus far, we're not seeing that. It's still very mild.
Yeah.
But we still have to be very cautious where it's concerned. So definitely the same rules would apply. If you're sick, you stay home, wear your mask, hand sanitize, social distance,
Yeah.
But it does appear to be very mild, and thus far, nothing is detrimental. I had a patient the other day that I was just about to deliver and she was COVID positive and I couldn't deliver at Andrews, so I had to transfer it to the public sector.
Yes.
Because there are rules in place for the private institutions.
Right.
So it's a part of life right now that everybody has to get used to, especially the pregnant women. But I just want to reassure the ladies that still, if you want to get pregnant, I wouldn't say don't get pregnant. Speak to your doctor. Do your prenatals, do your pre-checks, and I'd still encourage you. I saw the boom last year. There was definitely a boom in my practice.
Oh my God! Very active people.
Definitely a boom.
It's working from home, literally working, producing. But Doc, as we're talking about pregnancy and getting pregnant, a concern for a lot of women, especially now, career women like myself, you're oftentimes told your clock is ticking. You now hurry up. Well, wait, pan. You go all before you have baby. And a lot of women feel very pressured, and sometimes, it can be very insensitive.
Definitely.
Is there a cutoff point that when your clock a tick and them are going to pop off? Because people are going to say, I rush out. I don't know, talk to me about that something.
I like how you said that career woman as itself, we call it delayed childbearing.
Yes.
Because women are trying to achieve their career. Nothing is wrong with that.
Absolutely.
Right? They are trying to achieve their career, so we find women are getting pregnant older and older.
Yeah.
But historically, advanced maternal age has always been the age of 35. And what does that mean is that women over 35, they're more likely or more at risk to have problems, not only conceiving, but problems in pregnancy. Not saying that a woman over 35 cannot conceive and have a normal pregnancy, but how I tell patients, 85% of the time pregnancies go the way it's supposed to go.
Yeah.
My job is to be there in the 15%. I know what can go wrong. I know what I'm looking for. When you're greater than 35, you're at increased risk of miscarriage, increased risk of multiple pregnancies, increased risk of high blood pressure.
Multiple pregnancy, like you can pregnant.
Yeah.
Like twin and
triplets, yeah. So older women are at risk for getting twins versus younger women.
Where then? Jesus have mercy. Touch her under the table, you God. Me want go under the table. No. Lunette, where are you? Father God? No. What are they? Me and my little bread, there's a thing say, you know what? You're gonna get an age. Say you're not gonna have too much egg. Now, where they? What you say?
Yeah.
We're more likely
definitely
to have twins and triplets.
100%
So the same thing when we run up in
Yes.
No, I need a Panada. I need a migraine. Jesus, double trouble is waiting. It's locked up in my womb. I gotta tell you, no, I need berries. So, Doc, contrary to popular belief, it is more likely, you're saying?
Definitely.
That older women
are more likely to get multiple pregnancies than younger women.
Good afternoon, Heikel Nunes. All right. Very well. Boy. All right. That's how I know. Wow.
Everybody's familiar with the negative stuff, but like I said, the hypertension, the diabetes, increased risk of C-section, increased risk of not tolerating labor properly. Like women over 35, the studies have shown these are the problems. But with reassurance, once you're in the hands of a senior OB,
yes,
you should be fine. Because we know what we're looking for. We know the warning signs. We know when to tap out. We know when to refer. And I always tell, when you're with a doctor who has a lot of experience, you're in good hands.
Very well.
You're in good hands.
Very well. So ladies who are over 35, ladies who are over 40, don't lose hope.
Definitely not.
You're not out. You're not, don't count yourself out. We are very much. You can't imagine you go about one child at two. Sir. Boy, my tribe. You know what I'm going to do? I'm going to take a break, drink some water, and come back with Dr. Daryl Daley, my very special guest right here on Systems of Success series for 2022. Mighty God. No. Doc said twin. What a success. No, because you say I get pregnant all. Remember, say them say alpha ovary of.
Yeah, no, man, they can still get it.
Christ. Hold on there. 28.
Clearing shipments. Visit
28.
www.jkcustoms.gov.jm for details. The temperature by the Jamaica Customs Agency is
28 degrees Celsius in Kingston City and 27 degrees out west in Montego Bay. That's so funny. Daryl, are you kidding me?
Google it when they go.
Jesus Christ, man.
Real.
Look over there, seven safe. Calico. But I just get a flatbed truck for driving to work every day. Trust me, car.
Yeah, do one time and saving the trip.
Saving the trip. Get it out of the way. Get it out of the way.
When do it one go?
One go. Calico, 2 ball in one time. Is that a triplet in the book? Because I start ball too.
them do it, you know. Them do it. I mean, when you tell them so them pregnant and it's twins, it's like them a ball, man.
No.
Everything times 2.
Jesus Christ, watch Price Smart. No. Oh my God. Come like call me Aya Dazzle. Jesus. Mercy. The people that make it so like when you're old, you know, you're done for.
Oh man, it's far. No man, I have natural conception like saw a 47-year-old last week. Topping. Natural.
Oh wow.
No IVF.
That's hot. There is hope, God.
No IVF.
Good.
No IVF. And you know what happened? Because a lot of people when they're older they believe they can't get pregnant.
Yeah, that's alright.
I remember I had one of my patients came to me the other day. She was 46 and she come and she say she come because she not seen her period. I said, Doc, I think because I reached menopause. And I say, yo, do the pregnancy nobody with that, you know. I said, do the pregnancy test. Bright. Ultrasound. She never expect that one there at all.
Not at all. Left field.
Never said that one there.
Wow.
It happens. Once you're seeing your period,
yes,
you can get pregnant. That means the egg is being released. It just so happens as you get older, the egg get more resistant to the sperm.
Yeah.
So it's harder to get pregnant, but it's not impossible.
Gotcha.
It's not impossible.
Jesus
Once
peace.
everything working, you know, it happens.
20. But I have black fits.
I have to go on, dog.
Yeah? Yeah, too? You say drop on the glow here, that one there.
I've never heard that.
I've never heard that before. I've actually heard the opposite, you know?
Yeah.
That you can't get pregnant or it's difficult. Not twin.
Yeah, man.
That there is a high possibility.
Yeah, but I had a chance to get
Because
in.
and without even IVF, because I've heard
Yeah.
once you go IVF, it's almost like there's a possibility that.
Alright,
you
the
may
reason
have
for
multiple.
IVF will give you, alright, how IVF work, they fertilize more than one egg.
Right.
So they're trying to, so they'll implant 2 or 3 eggs. They
Yes.
fertilize eggs.
Yes.
So depending if those 2 or 3 catch.
Right.
So that is how you hear these multiple pregnancies.
Yeah. The
You understand?
chocolates and stuff.
Yeah. So that is how it works. You know, they do it to increase the chances of implantation.
Yeah.
You know, so some none going catch, some 1 going catch,
Yeah.
some 2 going catch, some
Yeah.
3 going catch.
Yeah, and some
You know?
non-do catch.
And some
so you have to
non-do
do-
catch.
yeah,
So you have to do it. You know, so that is why, but I can't really explain as to why it happens, but it does happen. It's in the literature, it's established.
I'm gonna try. Come like Billy just start hurt me. Because my sister said in your 40s, you know, it's less likely for you to have twins and stuff like that. Except if it is probably IVF. But not like naturally.
Naturally, yeah man, definitely.
Oh wow. Oh wow. So after 35 it's called what? Geriatric. Okay.
Or North American, where we use advanced maternal age, AMA.
Okay.
It's more palatable.
Absolutely.
Yeah.
You know,
I find
this
that
geriatric thing is very disrespectful. No, we don't use it in Jamaica. I hate to hear it. I hate to hear it. No, geriatric.
Like you're 80 and
Like
90.
80 and 90.
Yeah.
Geriatric is 80 and 90.
Yeah.
Advanced maternal age. You know, that is it.
I like that.
Advanced maternal age. Advanced maternal age.
Yes, Rasta. Mighty God. That's funny.
We got the city on lock all day. Every day.
Definitely still live all day, every day, Monday to Friday, 3 until 5 o'clock. Wherever you are in the world, we've got you covered. All you have to do is log on, listen in, and do remember to spread the word. It's always edutainment right here on my show. And my very special guest here this afternoon is Dr. Daryl Daley, Specialist Registrar in the Department of Obstetrics and Gynecology at the Maypen Hospital. And he is also a consultant obstetrician and cosmetic gynecologist at Gyne Associates and 3D Gynecology Limited. He's here with us, walking us through vaginal health care and those things that we ought to be concerned about. What should we do as women regarding our reproductive health? Because many times, we are invested in the children, invested in the husband or the boyfriend, work and everything else around us. And many times we leave ourselves aside and behind, and much to our own detriment. So it's a balancing act, and we have to try as best we can to ensure that we are on top of our reproductive health, and so we need to also take care of ourselves. Doc, let's talk a little bit. Well, you dropped a bombshell earlier, and I know many women in advanced maternal age, it was just a joy to hear what you said earlier, because oftentimes that's never mentioned, that's never said. And a lot of women go in a state of panic and anxiety because of the talk in the streets and what other people implant in our heads. And again, that is why it is so important to listen to those who are trained, listen to those who know, listen to those who have the science and know the literature to know what and where to go. Ovarian cancer, Doc. There are many women who, have presented with this. How do we know? And what are the symptoms we should look for?
Okay, unfortunately, compared to the cervix, there's no screening test. So the screening test for for cervical cancer is a pap smear.
Yeah.
So we're looking for precancer cells so we can intervene and treat. Unfortunately, for ovarian cancer, there's no screening test. So majority of the time, it's a late presentation, right? And you can have ovarian cancer in older women in the 5th and 6th decade of life, and you can have ovarian cancer in young women. Yes. Two different origins, right? But for all intents and purposes, the presentation may be late, right? So how they normally would present would be usually abdominal distension or the abdomen getting bigger, yes, right? And when they go to the doctor and the doctor examines them, they will notice that there's a pelvic mass there. You do the ultrasound or the MRI or the CT, and it will confirm that there's a mass there. And then you can do these blood tests that we call tumor markers, okay, that are elevated in ovarian cancer, right? So there are risk factors as well, strong family history as well, and age. Those are the two main risk factors. So it's not really. So how I advise women who are with a strong family history, definitely get a yearly assessment, yes, to look for it, because a lot of the times it's a late presentation. And when it's late, the prognosis tends to be very, very poor. Yes. So that's essentially it where it's concerned with ovarian cancer. It's not much intervention to do prior to. Yes. So basically you have to treat it as it comes.
How do we know as women what are signs of a healthy vagina or reproductive system as opposed to a unhealthy?
Okay, very good question. Healthy vagina normally, so all vaginas, contrary to popular belief, may have a smell. Right. Unhealthy vagina, there's a normal, what we call a normal physiological discharge. Yes. Right. There are usually no lumps or bumps. With regards to intercourse, it's not painful. You may not have any frequency passing urine or pain when you pass in urine. And essentially, the tissues are pink and healthy. Yes. Unhealthy vagina, or usually is associated with abnormal vaginal discharge. Yes. So anything that is suspicious, green, frothy discharge, yellow, gray, foul-smelling discharge. Yes. If you notice any lumps or bumps that are painful, yes, if intercourse is painful, if you have bleeding after intercourse, bleeding in between your periods, if you're passing urine and it's burning, these may signify indicative, yes, that there could be something going on that's detrimental, usually an underlying sexually transmitted infection. Yes. Usually, and again, this is my segue. When I was in medical school, we had this book, that the Ministry of Health did for medical students, and basically it told you how every sexually transmitted infection or disease presented. Like textbook, if you have this, if you have chlamydia, look like this. If you have gonorrhea, if you have HPV, and you went through it, and these were the exam questions.
Yes.
I can say in 2022 that book can be archived because everything looks the same right now, which is normal. You understand? So a lot of times, if you don't look for it, you're not going to find it. So I always tell, just like we can screen for pap smears, we can do STI screening. Because a lot of the times, there's nothing there.
Yes.
And you're not going to know unless you find it.
So we can go to our gynecologist and ask for a STI test as well?
Definitely. I screen all my patients. Once I see you, you're leaving with an STI test.
Okay.
All the time. All the time. That is like routine. It's like a reflex.
Okay.
For me.
Yes.
Because most of the STIs I diagnose, I would say 90% of the STIs I diagnose are from the test.
Yes.
Not from clinical examination. I mean, I remember many times patients will come to the office and will explain the results to them and say, but doc, when you examine me, everything looked healthy. You said everything looked fine. I said, yeah, that's why I test you, because, again, symptomatic and asymptomatic, you know.
Yeah.
I'm so happy for this. I mean, I'm not happy that COVID came, but everybody's familiar with this terminology. So when patients come, I can explain it to them and I understand so much better. It's much easier for them to understand the difference between symptomatic and asymptomatic.
Yeah.
So screening is important. STI screening is very, very important because...
So we need to ask for HPV screening. We need to ask for the pap smear. We need to ask for the STI screening as well. And of course, if you have a strong family history of, say, ovarian cancer, you can ask to be tested to get tumor markers.
Yes.
And
ultrasound.
And ultrasound as well. We're going to take the time signal. We're here with Dr. Daryl Daley right here on Miss Kitty Live.
The time by Hilo Online is
4:46. All right, Dr. Daley. Somebody's asking if I have fibroids, is a hysterectomy a must if it's really bad? And that is, I'm happy that person asked the question because oftentimes people think fibroids equals hysterectomy. And so, I'm just going to hold it, I'm just going to keep quiet because I don't want to have a hysterectomy.
Okay. So again, everybody's individualized, as I said. So one of my opening questions, when I know the patients have fibroids, the first question I ask, do you want to have any more children?
Yeah.
That's very important in me finding out what options I'm going to explain to the patient. So usually you have two main surgical interventions for fibroids: a myomectomy, that is the removal of the fibroids, and a hysterectomy, which is removal of the uterus. Yeah. So for all intents and purposes, women who are younger, who are still anticipating childbirth, will offer them a myomectomy, versus women who have completed having all their children, they don't want any more children at all, we can offer them a hysterectomy. Because what can happen, even though we take out the fibroids, they can come back.
Yes.
And that can be problematic as well. So counseling is very important when you're talking to the patients, and individualizing the management is very, very, very important. So some women may need a hysterectomy, and some women may need a myomectomy.
Yes.
So it's very important to talk and find out where they are and what their expectations are, and you can offer the best options to them.
Very well. Back to the unhealthy vagina. Right. Yes.
Very important. Very important.
Yes. Because sometimes, doc, we are having symptoms or we're seeing things and we just think it normal and you just think it will go away. But this is actually a cause for concern and you may need to go and see your doctor. So you're talking about the smell, the look, the bumps, the lumps.
The burning.
Yes.
Yeah, and I always encourage women to look on your vagina every day. Be familiar with it. You're familiar with your breast, you examine your breast. There's nothing wrong with taking a mirror, examining, something looks off here, not too familiar with this. This wasn't there last week. What is that there right now? And there's nothing wrong with running to your doctor, even to get some sense of reassurance or to find out what it is.
Yeah,
there's nothing wrong, some clarity.
Yeah.
Exactly. So examine yourselves. And anything that is off, odor, smell, low abdominal pain, fever, painful sex, these are telltale signs that something underlying could be going on and you need some kind